I think a lot of people, myself
Definitely.
included, were unsure what would happen
Mm,
next. And when you look at the health select committee, you know, I'd like
mm,
to think if anyone went back and looked at the questions I asked, I think they were fair
mm,
questions at the time. I remember one of them was around mental health, actually on that point.
mm,
So I remember a nurse, actually, I think it was a nurse, but it's someone who was working in the hospital. And it was when there was a period where there was a concern around PPE and whether we had enough PPE. And my memory was that I would phone the hospital, my local hospital, almost daily and say, look, if you've got enough, is there anything more I can do? And they'd always reassure me, look, it's getting tight, but yeah, we're okay. And I remember speaking to this whilst I was volunteering, and I don't think they knew I was an MP actually at the time. I wasn't hiding it, but you know, it wasn't
yeah,
necessary to bring it up. But we were having this conversation, and they said that
yeah,
their work was for their family who were at home, because they said that they were coming to work, they knew they had enough PPE, but their families were watching TV. To your point about fear mongering, and on the TV it was saying that everyone going into work in hospitals was at risk. There wasn't any PPE, and their families were suffering in their mental health because they were worried about their family member working in the hospital, which in turn stressed them out and made them feel bad.